Sounds like it's recording.
I guess so.
Okay, hi everybody. My name is Renee Tumolo. I am a social worker and a certified coach, and I'll let my husband introduce himself.
Hi everybody. My name is Peter Tumolo. I am a licensed professional counselor and the owner and practitioner of Growth Counseling in Chandler, specializing in trauma. So happy to be here with everyone tonight. Okay, well, before we get started, I always take a moment to just let everyone know today's topic, we're going to be talking a lot about trauma. And anytime we do talk about trauma, we always want to give a disclaimer that it's really important to take care of yourself through this presentation. We might be talking about some difficult topics. So if you do start feeling emotional or triggered, obviously, close your computer, step away, and return to the material when you're ready. So we always like to start out our presentations with a short mindfulness exercise. I just encourage you to maybe take just a few moments to center yourself a little bit, and start by taking a few slow, deep breaths in. And just follow your breath as it comes into your body and as it leaves your body. And just noticing where your feet make contact with the floor, maybe where your body is touching your chair or couch. And just bring awareness to this moment, to your breath, to your body. Just taking a moment to putting any stressors or to-do lists aside and really just getting present for just a moment. And when you're ready, you can bring your attention back to the room. Just take one last deep breath in, letting it all go. And allow your eyes to open whenever you're ready.
Okay, thank you. Mm-hmm. So we like to start with this just as a really good example of something that we can do for ourselves when we start to feel elevated or dysregulated. It can be very short. It doesn't have to be minutes long even. And it's something that we can teach our kids. And one way to teach mindfulness to our kids is called square breathing. And so a lot of times we will show our kids to draw a square on their leg, but I'm just going to show you here on my hands since you can see us on camera. And they're just going to draw a square on their hand, and they're going to count to 4 as they draw a line. So when they breathe in, they're going to count to 4, 1, 2, 3, 4, and then hold for 4. And then they're going to let it out for 4, 1, 2, 3, 4. And they'll do that again to complete the full square. Even something that short can really help regulate a child's system. And then I also just want to mention that there are a lot of apps that explore meditation and mindfulness practices for both adults and kids. My favorite is Calm. That's what we use for our kids. But there's also Headspace, Healthy Minds. And if you're looking for a faith-based meditation app, there's Abide. So you could check that one out as well. Okay, so let's start off with what is trauma. The definition from SAM says that trauma results from an event, series of events, or set of circumstances that are experienced by an individual as physically or emotionally harmful or life-threatening, and that have lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. So if that's not a run-on sentence, I don't know what is. That's not something you're going to memorize. So let's break it down to something a lot simpler. Let's just focus in on the 3 E's of this definition. So trauma is the event, how the event is experienced, and what effect that event has on the person. So what we want to point out here is that trauma is experienced, it can be experienced differently. Different events can be experienced differently by different people. So not everything that is trauma to one person is going to be trauma to another. So an example that we always give is if there was a fire in a hallway of a school and it was in the first graders' hallway, those first graders are going to experience that fire a lot differently than maybe the sixth graders who are all the way across the building on a different floor. And everyone in that school building is going to experience that fire differently than the firemen and women who come in to put the fire out. So we are going to have events that happen to us that are going to be experienced differently based on our age, our proximity to the event, our preparedness. So we have to be really careful about not judging ourselves or others on whether or not an event feels traumatic to someone. So big T trauma versus little t trauma. I always say I don't love that we even put a distinction on these because trauma can have the same effect on people's mental, emotional, physical health, regardless of whether or not it's considered a big T trauma or a little t trauma. But it's important for you to understand these terms because it is used in the literature and in the field of mental health. So big T trauma are life-threatening and or extreme events or situations. So in the time of COVID, this may have been, losing a family member to COVID. Other big T traumas, help me out here, babe.
Big T traumas, yeah. Abuse, physical abuse, sexual abuse, natural disasters where life is either at risk or life is lost. Any of the wartime trauma, of course. These are the things that most people typically think of when we think of traumatic events. It's the little t traumas that are usually more, get sometimes categorized as just adverse childhood difficulties that we might all go through. And that's true. Getting bullied at school or moving a lot as a kid. But they can still have an impact or still have an effect.
Yeah, thank you.
Yeah. Mm-hmm.
Excuse me, I'm getting over a cold. So a little t trauma, still significantly distressing, but does not typically include a violence or disaster. And so going back to that COVID example, suddenly having to attend school online and losing the ability for the kids to socialize physically with their friends, that could have been experienced as a little t trauma. And then Pete mentioned another one, I think he said relocation. Some others are parental divorce, maybe a breakup with a boyfriend or girlfriend, the death of a pet, or being bullied. So let's just touch on what trauma is not. Trauma is not age-appropriate challenges, trying hard and failing, being given difficult homework, being told no, being redirected in class in a respectful manner, and trauma is not age-appropriate consequences. So it's important to remember that age-appropriate challenges, when a kid has the support of a healthy adult, an age-appropriate challenge is going to help build resiliency, and it is necessary for healthy development. Where it can be traumatic is if there are some challenges or trials that a kid is going through and they don't have support from a healthy adult. That can be where trauma comes into the picture.
Mm-hmm. And I would just like to add to that, or they might not have the skills to handle it.
Right.
What one kid can handle because of skill building early on in life, another child who hasn't had those skills built and doesn't have the supportive, healthy adults in their life, that thing might be really, really difficult for one kid to do. And that kid might be getting really elevated if pushed to try to overcome a challenge, whereas other kids might be able to handle that very, very smoothly.
Right.
Yeah.
Okay.
All right. So I like to think of trauma with this analogy. I often share this analogy with my clients. And the analogy goes like this. Childhood trauma is like breaking your foot in childhood. And we walk around in life with this broken foot. We don't realize it's broken most of the time. But as a result of the broken foot, we would start walking with an unsteady gait. As a result of the gait, our knee might go out, our hip might go out, we might get a strain in our shoulder, and then maybe a crink in our neck. And the knee and the shoulder and the neck kind of represent what we typically see as the symptoms of trauma. This might be depression, anxiety, strong oppositional behaviors, drug use, alcohol addiction. But oftentimes, people think of these as the main problem in a kid's or adult's life. And I prefer to see them as very normal, natural occurring symptoms as a result of the broken foot. And so in trauma therapy, what we try to focus on is the broken foot, the root cause of where these very normal symptoms, normal given the broken foot, where these normal symptoms are coming from, and work on the foot. Another important analogy that I like to use with my clients that I think can be helpful is this flipping your lid. So back when I was young, we used to say all the time, that guy really flipped his lid. It kind of meant they wigged out or, was kind of acting out in some way. So if you put your thumb in the middle of your hand and wrap your four fingers over it, this is a pretty good diagram of the human brain. And the four fingers here represent our prefrontal cortex, and our thumb represents our amygdala. And so our amygdala is our fight-flight response center. So when you think of someone getting triggered, a trauma trigger, for example, you can kind of think of them as flipping their lid. In other words, our prefrontal cortex is offline. And I don't mean that figuratively, I mean that very literal. If you were to hook up a brain to an MRI with someone who is having a trauma flashback or a trauma trigger, you would not see a lot of activity coming from the prefrontal cortex. There would be a lot of activity coming from the amygdala and the hippocampus actually as well. So why is this important? In our classroom, if a child is having an episode, what we really want to do is help them get back into their prefrontal cortex. This is the part of our brain that helps us learn, helps make connections, helps keep us calm and safe. And so, when the amygdala is lit up, the behavior that we're seeing, again, is very normal given the part of the brain that's activated. It's not bad behavior, and we're going to talk about that here in just a moment. So there are three main states of our central nervous system. And the first one is ventral vagal. This is called our social engagement system. This is how we ideally want our classrooms to feel. This is how we want our homes to feel. They don't always feel this way. But ideally, when everyone is in our ventral vagal or social engagement system of our central nervous system, we are naturally feeling calm, connected, compassionate, relaxed, a sense of safety and security. We're pretty engaged and focused. However, we have the sympathetic fight-flight response system of our central nervous system as well. And it's important to note that this is not bad. This part of our central nervous system has kept us alive as a species for millions of years. So we need, at times, to fight or run from threats or danger. So what we might see in a person who's in fight or flight or sympathetic activation is racing heart, muscle tension, anger, hypervigilance, hyperarousal. This is where we see a lot of stress, anxiety, what we often unfortunately label kids as oppositional defiant disorder or ADHD. And I'm not saying those labels and diagnoses don't exist, but it's also more important to get underneath those labels and diagnoses and just understand what's happening in the system as well to help. The next one. And the third is freeze or shutdown, commonly referred to as dorsal vagal shutdown. This is responsible for that freeze response. Symptoms here: depression, low energy, dissociation, spaciness. If you have, some kids in class with their head down and the hood over their head and they're just totally checked out. Yes, they might be bored, but they also might be in freeze or shutdown response as well. So emotions and behaviors related to the sympathetic, this is the fight-flight system. When this system is activated, these are, again, normal. I'm not saying enjoyable or fun things to deal with, but they are normal behaviors when that system is activated. They can cause consequences and they can be difficult to deal with, but it is normal given the system that is on. And these are behaviors that we might see from someone who is in dorsal vagal system activation. Okay, again, not the most pleasant behaviors to deal with from our kids from time to time, but just evidence of what system is on.
Okay, so some key takeaways around trauma and the central nervous system. Trauma affects our brain chemistry and the central nervous system. The emotions or behaviors in our students, our kids, ourselves, they are information around what system is currently in use. So back to what Pete was saying, these aren't bad behaviors or bad kids. These are symptoms of what is showing us what system has been activated in the situation, and that gives us information around how we might be able to intervene to help their brain or our brain come back online. And then also, effective teaching and learning can only take place when both the adult and the child are calm and engaged. So that visual that Pete gave you, we really do have to have this prefrontal cortex online in order for us to teach, and our kids have to have it online in order for them to learn. So once a lid has been flipped, whether it's the kid or a student or a parent, a teacher, once that's flipped, there's no ineffective teaching or no effective teaching or learning taking place. Okay, so we're going to move into a high-level description of adverse childhood experiences.
Okay, so this was a study conducted by the CDC and Dr. Vincent Felitti at Kaiser, and it actually came about sort of by accident. Dr. Felitti was doing a study on obesity, actually, and he had his patients who were suffering with obesity. He was trying to help them lose and maintain a healthy weight. And he was really successful at that. However, after the study, his participants usually returned to their pre-study weight. And he was really confused and troubled by this, and he started interviewing his participants in the original study, and just started asking questions about their childhood. And he found out that many of his patients had experienced sexual abuse. And when he dug a little bit deeper, a lot of them told him that, feeling skinny felt threatening because, people were, they were looking and feeling more attractive, and therefore, men were coming up to them, or they had to deal with all of that. So not that they were trying to gain weight, but that was just what the body did. And he found this really interesting, and so he decided to come up with this questionnaire called the Adverse Childhood Experiences Survey. And so he asked over 17,000 participants, about half were female, about 75% were white, the average age was 57, about 75% had attended college, all of them had good jobs in healthcare, and the participants were asked 10 questions about childhood trauma. So the questions that he focused on were physical abuse, sexual abuse, emotional abuse, physical and emotional neglect, exposure to domestic violence in the household, exposure to substance abuse in the household, any mental illness in the household, if parents were separated through divorce, and if they experienced a family member getting incarcerated. And the questions were specifically from birth to 18 years of age. And so basically, as he asked participants this, if they answered yes, you get a score of 1. Higher ACE, obviously more trauma present in childhood. And so some of the findings were that ACEs are really more common than we tend to think. Nearly 2/3 of the adults had at least one ACE. We also learned that ACEs don't occur alone. If you have had one adverse childhood experience, there's an 87% chance that you've had 2 or more. The more ACEs you have, the greater risk for chronic disease, mental illness, violence, and being a victim of violence. The ACE study found that childhood adversity contributes to most of our major chronic health, mental health, economic health, and social health issues. And it also doesn't matter which 4 ACEs a person has. So 4 was sort of this magic cutoff number. So ACE score of 4 or more exponentially increased these things. So it didn't matter which 4 ACEs a person had, the harmful consequences were still the same. Our system doesn't distinguish between one type of toxic stress from another. It all just feels equally bad and dysregulating to our system. Is this mine or yours?
Actually, I'll take this one.
Okay.
So the factors that affect outcomes. The younger the child was at the time of the event, the more adverse the effect. Of course, the more repetition of the trauma, the more adverse the effect. And then the less protective factors or figures that the child had, the more adverse the effect. So all of this feels really heavy. And when I was learning about this study, I felt like, oh my gosh, so, what does this mean? It feels a little hopeless. But this last bullet point is what brings in the hope. So studies show that a child who has at least one safe, secure, and attuned adult in their life significantly reduces the long-term effects of trauma. And that can be any adult. It doesn't have to be an adult that lives in the home. So it can be a parent, a teacher, a youth group leader, a coach, a counselor. And that is going to significantly help that child recover from the effects of trauma.
Hold on. I want to add to that for just a second. So I'm going to give more hope.
Yeah, good. Please do.
The reason that is, and as Renee said, yes, that's true. One safe person in the kid's life, but there's a term called neuroplasticity, and what that means is our brain is actually moldable. It changes, and the way it changes is with experiences, positive or negative experiences. So yes, one supportive parent, teacher, coach, counselor, that's great. More hope is what that person can do for that kid and offer different experiences, whether they get them involved in an activity or sports or some kind of hobby or interest that they enjoy and they feel confident in. All of that is helping mold this plastic brain we have. And those events and memories are stored in our memory networks in our brain, and that actually changes who we are. So even though it does, the survey and the statistics do feel pretty grim, the fact of neuroplasticity always allows for hope.
That's good.
Yeah,
I'm glad you added that.
Yeah.
Okay, this one's yours.
Okay. So why is this important? So, the kids that you all are working with, I'm assuming there's a lot of teachers watching this. These kids are coming into your classroom. 2/3 of them may have already experienced at least one ACE. Of that percent, 87% of those kids may have experienced 2 or more ACEs. So this is important because you guys are all dealing with this. It's walking into your classroom. It's way more common and prevalent than we think it is. And these, we tend to think of trauma in the short term. Well, this happened 10 years ago for this kid. That doesn't matter. Our systems do not know the difference between the past, present, or the future. I often say the past feels present until it's processed. And so unless that kid is having some positive experiences, gaining some resources, some support systems, molding his brain in a more positive way, the past still feels present. It doesn't matter if it was 10 years ago, 15 years ago. And these are the kids that are, walking into your classroom. It does not require for that child to remember the event. A lot of these things happen in really early years of life. Domestic violence, mom and dad are screaming and yelling and fighting and throwing things at each other. That baby may be 1 or 2 years old. They may not have what we call explicit memories of those events, but they definitely have implicit memories, meaning body sensations, the felt sense. And so you as a teacher, if your voice starts to raise, that may be a trigger for a kid. And of course, we don't know that necessarily, but it's important to keep these things in mind. So when left untreated, ACEs are a precursor for poor mental and emotional and physical health outcomes. Knowledge about ACEs helps shift the dialogue from what's wrong with that kid to what happened to that kid, creating curiosity and connection, which are necessary for change to occur. And that's really our key takeaway. If you get nothing else from this presentation, it's shifting that narrative from, geez, what's wrong with that kid, to what happened to that kid? What's his story? What's his narrative? What's his broken foot? Why is his system so activated? Why is he oppositional and defiant in my class? There's always a reason why.
Okay, so key takeaways from the ACEs study. As parents and teachers, it's important to do our own internal healing work, because what we don't repair, we repeat. So not only are the kids and students that we come in contact with, not only are their ACEs going to affect how they can connect with us or other adults in their lives, but it's vice versa. Our own ACEs can affect our ability to connect with the kids that we come in contact with. And then this last bullet point, which again goes back to that hope, you have the power to significantly reduce the long-term effects of a child's trauma by being that safe and secure person when they are with you. Okay, so we've talked about trauma, we've talked about the central nervous system, we've talked about the ACEs study. So let's talk about how we then apply a trauma-informed approach. How can we be trauma-informed in the environments that we're in? Okay, I think this one is mine. Yep. Okay, so the very first thing we're going to touch on is what Pete just said. If there's anything that you take away from this presentation, we want this first bullet to be it. When someone's behaving outside of the norm, we often will hear people say, "What's wrong with them?" And what a trauma-informed helper will ask is, what happened to them? It's really important to take the judgment out of that and to be really curious about why these behaviors are showing up. Labeling behavior and or kids as good or bad is forgetting to ask that question. It's ignoring the why. So a trauma-informed helper will describe the behavior without applying judgment. Labeling someone as their diagnosis or behavior is too simplistic and potentially dehumanizing. So a trauma-informed helper will say a child with versus that, that obstinate child or that attention-seeking child. We could say a child who's exhibiting hyperactivity, or a child that's seems to need some attention. These are the ways that we can kind of shift our language just a little bit to take that judgment out. So just to kind of, put this point down over and over again, there is always a root cause to why someone is behaving the way they do. And hopefully as you start to think about this with the kids in your lives, you'll also start to turn it towards the adults in your life as well, and even towards yourself, and maybe how you judge yourself and the way you react towards things. So changing the words we use and the questions we ask is going to help us remain curious. And then it allows us to approach these situations from a non-judgmental place so that we can consider solutions.
I want to add one more thing.
Okay, go for it.
Because I'm sure there are teachers here like rolling their eyes behind their computer screen. Of course, this kid is bad in class. And I just want to, validate I don't know how you guys do your job. There are some tough kids in the classroom, and that is hard to deal with, and they can be very disruptive, and that can be very frustrating, and all of that is true. Yet labeling them bad does absolutely nothing to help that kid either. Right. So, again, I'm not suggesting that the symptoms of this are pleasant to deal with, easy to deal with, fun to deal with. They have real consequences in life. So you are valid in thinking it is, stressful to do all this, because it is. But just really getting curious on what's under the behavior. What are they really needing? Why are they acting this way? I guarantee you these kids are not waking up every morning saying, how do I, totally derail Mr. or Mrs. So-and-so's class today? That's not what they're doing. They're not deliberately walking into the class wanting that. They don't want to act that way. It's our job as the parents and the teachers and the adults in these kids' lives to help them learn a different way. So I just wanted to.
No, that's good. I'm glad. Yeah. It's important that you feel validated in your frustration.
Yeah.
Because we are parents too,
That's
and
right.
we know what it feels like.
That's right. That's right.
Okay, so let's go over just some other ways. We kind of talked about how important words are and asking the right questions, but let's talk about some other practical ways to create that trauma-informed environment. First, regulating your own system. So being aware of your own trauma and your own triggers is really important. And in order to regulate your system, you can do things like what we did at the beginning of this presentation, a mindfulness, quick mindfulness moment, doing some breathing techniques, a quick meditation, maybe before school starts or before you pick your kids up from school. Those are some ways to regulate your own system. Meeting the child where they are. So it's important, and I know teachers really understand that it's important that you have information around where each child is developmentally so that you can have realistic expectations. Remove judgment and criticism. So again, seeing under the behaviors, understanding what system has been activated, and then not applying any judgment to that. Practicing patience. That again kind of goes back to that mindfulness and meditation. Creating an environment where kids feel seen, safe, soothed, and secure. So Dr. Dan Siegel, he's one of our favorite parenting experts. He says that these are called the 4 S's, and that this is what creates healthy attachment with kids. We can help them feel seen, safe, soothed, and secure. And some ways that we can do that is by connecting with them. Like Pete mentioned earlier, creating those different experiences with them. It's not just that they have a safe adult in their life, it's that they have experiences with that adult through connection. Making eye contact, exhibiting positive body language, asking the kiddos open-ended questions. These are ways that we can practice those 4 S's. Be conscious of your tone of voice. Again, tone of voice can really be triggering. I think even a lot of adults feel that. So children definitely are sensitive to that. Bringing mindfulness into the home and the classroom, and we've talked about ways to do that. And then practicing compassion in your daily life. Every meditation app has a loving kindness meditation, and I love those because it really is to help build compassion towards people we already love and people we really struggle with, and even practicing it towards ourselves, that loving kindness, compassion towards ourselves. It helps us focus on the good that we see in others and in ourselves. All right, you can take this one.
Okay. So continuing to create a trauma-informed environment, provide age-appropriate childhood challenges so they can learn how to manage failure. So this is important. Again, I think kids do need challenges. They don't need toxic stress. There's a difference. Age-appropriate challenges that they can strive and struggle with a little bit, but hopefully overcome. And even if they don't, then hopefully an attuned adult is there to help them work through the failures. That helps build resiliency. It helps children grow. It is not trauma. Utilizing eye contact, as this helps bring a child back online. Apologize when you lose it. So we call this making a repair. And that's really important. Making repairs strengthens the bond between a parent or a teacher, and helps children calm their fears. It also role models accountability, right? We always want to teach our kids how to take accountability and apologize when they make a mistake. No better way of doing that than role modeling it for them. Validate emotions. Don't just brush emotions under the rug or mock or ridicule them. We can accept emotions and still set limits on the behavior. So, it is okay to be angry. It is not okay to throw your computer across the classroom. Those are two different things. The anger is fine, but the behavior, could be harmful. And a lot of times adults tie these two together. I hear a lot of the parents I work with, well, if I validate that anger, I validate that, aren't I just feeding into that? No, that kid is feeling seen and heard and understood, and that feels good. They will not continue that bad behavior. They might, but validating the emotion will not do that. Just think about it. If you come home and you had a really hard day and you're venting and you're stressed and because of work, and you're kind of whining and complaining a little bit, and your spouse says, "Oh man, that's really, you had a hard day. That really sucks." Does that motivate you to continue to whine and complain? No, you feel seen, and that actually helps bring that down a little bit. Versus if you just said, "Oh, it's no big deal, suck it up, get over it," right? Well, no, now I'm still frustrated. So validating emotions does not reinforce negative behavior. Name it to tame it. Just naming emotions sometimes helps bring the alarm system down and the brain back online. I see this with my 7-year-old daughter all the time. If she's throwing a fit, I just say, "Oh man, you look like you're so frustrated right now." And she goes, "I am really frustrated." And then takes that breath, and things just start to soften a little bit. So especially with the younger kids, just naming emotions sometimes can be really helpful to help get them back online. Physical contact as appropriate. Obviously, I don't know, some of you are probably teaching teenagers, but parents, sometimes just hugging your kid when they're really dysregulated. I know that helps with my son quite a bit. We don't need to lecture at that point or point out all the things that are happening. Remember, when the lid is flipped, our job is to help it get right back online. Physical contact, some deep breaths, some attunement is one of the best ways to get that kid back online. The lectures and the conversations can come down the road. Amplify the good, which really just means pointing out, and this goes back to that neuroplasticity of the brain, showing them, the experience. I might be at the park with my kids and just say, "Oh gosh, look at this, such a beautiful day, and the sun's shining and the birds are out, and look at the trees, and I'm having so much fun with you." Just taking that 2 seconds, and then that they kind of bring that in, and that helps structure and mold the brain for positive experiences. Obviously, for the teachers that are listening, a review, update, and utilize 504 plans and IEPs. And then, connecting students with school counselors or, outsourcing that to child therapists in the community.
Okay. So tips for self-care, we wanted to get this in here because if we are going to create a trauma-informed environment, it's really important that we take care of ourselves. I'm sure all teachers know this, and as a social worker and Pete as a therapist, we know that it is really easy to get to burnout phase if we don't take care of ourselves. And when we're in burnout phase, we're not going to be able to be trauma-informed and show up in that way for the kids in our lives. So if you've experienced even one ACE, it's beneficial, and we highly recommend that you seek professional assistance via counseling or a support group if you haven't already. And then engaging in activities that help regulate your central nervous system. So this is just a few here, obviously not an exhaustive list, but exercising, reading, writing, yoga, meditation, prayer. There's lots of activities that can help regulate your central nervous system. And what I'd like to add is that if you can do any of those things in nature, that's even better, because being outside automatically has an effect of regulating our central nervous system. So that is an added bonus if you can do those things outside. Taking time alone. that's important, obviously, just to reset, just to take a breath, just to get in touch with the present moment. Working towards getting your needs met in healthy and appropriate ways. And one of those ways is by being able to set healthy boundaries in your personal and professional life. If we don't set up healthy boundaries in our lives, we can end up feeling taken advantage of. And when we put our own needs on the back burner over and over again, that's what's going to lead to burnout. So continue to practice setting those healthy boundaries. Not only is it good for you, but you're also modeling that behavior for the kids in your life, which will serve them well as they get older. Okay, so that is the end of our presentation. We do have some case studies that are in the presentation that in the slide deck that I shared with Sarah that I know can be sent out to everyone. So you can see kind of how it might play out in the classroom with different aged kids. But Pete and I also just want to let you know that if you have any questions or comments, or maybe a particular case that you'd like to get our thoughts on and you know, see what we would do or how we would recommend handling a certain situation, we would love to hear from you. So if you do want to contact us, please feel free to shoot us an email, and we'd love to be in touch.